Welcome to Champions of Care, brought to you by Oakwood Healthcare. My name is Mary Zatina. Every 40 seconds, someone in the United States has a stroke, and every 4 minutes, someone dies from stroke in the United States. Today, we're going to talk about this very important topic, stroke. And with us in the studio is a stroke expert. Let me introduce you to Dr. Daniel Singer. Hi, Dr. Singer. Welcome to Champions of Care.
Thank you very much.
Now, you are an Oakwood-affiliated neurologist at the Michigan Institute for Neurological Disorders. You have offices in Farmington Hills and Garden City, and you're also medical director of the Oakwood Primary Stroke Center. So that makes you quite an expert on stroke.
Thank you.
Let's start with a really basic question. What is a stroke, and are there different kinds of stroke?
Stroke is when a certain area of the brain doesn't receive blood flow, and it causes any one of a number of different symptoms, anywhere from difficulty speaking, or weakness, or numbness, or headache, or visual disturbances. There are two main kinds of strokes. One of them is a lack of blood flow stroke, and therefore some of the brain tissue gets damaged. And the other kind of stroke is a bleeding stroke, where there's a bruise on the brain, and that causes the damage to the area that can cause the symptoms.
Is stroke more common as we get older?
Yeah, by far the biggest risk factor in stroke is age. And unfortunately, I've been looking for the fountain of youth for all of my patients, but we haven't quite found it yet. That would be probably the best thing we could do in stroke care.
What about different ethnicities? Do certain ethnicities have a higher incidence of stroke than others?
African Americans certainly have a higher risk factor for stroke, as well as Hispanic Americans. Part of that has to do with the genetics of some of the risk factors that go into stroke, like hypertension and high cholesterol, and certainly that they have an increased risk compared to non-Hispanic Caucasians.
So you mentioned the genetic factors. Do strokes run in families?
Strokes certainly can run in families, and there are certain disorders that present as stroke and stroke syndromes, but oftentimes we think more of the risk factors that lead to stroke that are often genetic and run in families.
Now, I understand there's a condition called atrial fibrillation, I think that's how you pronounce it, that can lead to stroke. What exactly is that, and how does a person know if he or she has it?
Atrial fibrillation is actually a heart problem. So one of the issues that can happen in stroke is that if a clot forms somewhere else in the body, usually in the heart or in the carotid arteries in the neck, it can travel north towards the brain to cause the problem. Atrial fibrillation is when the upper chambers of the heart don't beat properly, and therefore blood can get stuck in there and end up causing a slight clot that can move up towards the brain. Symptoms of atrial fibrillation, or AFib as it's known as, is often palpitations, irregular heartbeat, things like that, and it's something that if you feel that as a patient, certainly talking to your doctor about it and getting worked up and getting an EKG at least at the bare minimum is important.
So you've told us that there are some things we just can't do anything about. This AFib, I'll call it, also some of the hereditary factors. Well, what can we do something about to prevent stroke?
Probably obviously we can't prevent growing old as much as a lot of people would like to. But there are certain things, certainly smoking is a big one, and there's a lot of reasons that patients shouldn't smoke, and hardening of the arteries associated with smoking and then leading to stroke is a big one. And then getting the other risk factors under control. If we talk about just lifestyle modification, certainly diet and exercise, working on your weight and being physically fit, and then some of the other diseases that can lead towards the risk factors, like high blood pressure, high cholesterol, diabetes, making sure you see your doctor regularly, take your medications, are compliant with follow-up, getting all of those other diseases under good control greatly reduce your risk to have a stroke.
So what if the unfortunate happens and someone does have a stroke? What are the symptoms of stroke? How do they know it's stroke and not something else?
Well, I guess the it's going to be difficult for a patient to know at home that it's not something else. And nowadays we really want to err on the side of assume it's stroke and act fast and to make sure you get to the ER as fast as you can, because there's medication that can be used if you get to the hospital quick enough.
Now, this medication that you can use if you act fast, and we're really emphasizing that word for a special reason, but that medication didn't exist years ago when my grandparents had strokes and my aunts and uncles had strokes. Is that true? Is this something new?
Well, it's newer. It actually kind of came to the market and started to gain some popularity in the mid-90s. Over the course of the last 10, 15 years, we've gotten much better at administrating it. We've gotten other ways to deliver the medication, not just through an IV, but sometimes actually there's procedures that can be done to go and actually look for the clot and extract the clot if you see it. And all of that is really time dependent. And so it's the patients who have symptoms in the evening and they decide they're going to sleep it off. And by the time they get to the hospital in the morning, then it's too late to do a lot of those emergency interventions.
Now that word, fast, refers to some of the easy to remember symptoms we should watch for, which might indicate get to the hospital. What is that, FAST?
So FAST is an acronym that stands for face, arms, speech, and time. So one at a time, face, either looking in the mirror, or if it's a loved one, asking them to smile and see if the face droops or is asymmetric. A is arms, asking the patient to raise their arms up, and does one drift downward or does one appear to be weak. S, speech, have them repeat a simple sentence, and how does their speech sound? Is it slurred? Can they not get the words out? Can they not spit the words off of their tongue? And then time is of the essence. The T stands for time, meaning call 911 and get to the emergency department as fast as you can.
Well, thank you. That's a very important little mnemonic device to help us get our loved ones to the hospital in a timely fashion, or for them to realize this is something special, I better call 911. We've been speaking with neurologist Dr. Daniel Singer, your head of the Primary Stroke Center at Oakwood. Thank you so much for being with us.
Thank you for having me.
And when we come back from a very short break, we'll talk with an emergency room physician a little bit more about this notion of why it's so important to get to the ER fast. Stay with us.